company named Color Genomics recently grabbed headlines by announcing that for $249, they'll be offering a cancer gene panel for 19 hereditary cancer genes. This includes the hereditary breast and ovarian cancer genes BRCA1 and BRCA2, as well as the 5 genes associated with Lynch syndrome, which is hereditary colon, uterine, and ovarian cancer. Now let's back up a minute and talk about why this is so impressive. Less than 2 years ago, there was only one company allowed to offer BRCA1 and 2 testing in the United States because of a patent on those genes. And that company was, and still is, charging more than $4,000 a person for BRCA1 and 2 testing. And so Color Genomics has undercut that down to $249 for BRCA1 and 2 and 17 other genes. So does this mean that everyone should run out and invest $249 and have this cancer gene panel? Actually, probably not, at least not yet. And the reason is, if you have no personal or family history of cancer, particularly of breast, ovarian, pancreatic, colon, or uterine cancer, your chance to carry a mutation in one of the genes in this 19-gene panel is probably pretty low. And in fact, your risk of finding an ambiguous finding that we can't interpret might be higher than your risk of actually finding a meaningful result. But there are some people for whom this panel is golden. Who are these people? They are people with a strong personal or family history of the cancers we've discussed: breast, ovarian, colon, uterine. People who have particularly early onset cancers in their family and multiple family members affected with cancer on the same side of the family, whose insurance won't pay for them to have genetic testing, or people who don't have insurance, are underinsured, have a huge deductible, and therefore can't use their insurance to pay for testing. Also for people whose insurance companies won't cover panels, even though you and your genetic counselor have deemed that you're really a candidate for panel testing because your family history is so suggestive of a hereditary cancer syndrome and nothing has been found so far. So $249 is where the bar is now set. And hold on to your seats because more is happening very, very quickly in the area of genetic testing.